Spotting during pregnancy. Now, what is spotting? Spotting is the term to describe vaginal discharge that comes out that is stained with blood. So spotting can appear brown, it can appear pink. Spotting rarely looks like it's bright red, fresh blood. So if you are spotting in pregnancy at any stage, it's a good idea to let your care provider know. But the chances are, if it's just a slight one-off bit of spotting, then it's probably nothing to be alarmed about. If you're in your first trimester, if you're at the very early stages of your pregnancy, it's quite common actually to have a bit of spotting, which we call implantation bleeding. So around 4 to 5 weeks, you can have a little bit of a brown discharge that occurs for maybe a day or so, not particularly heavy at all, barely actually noticeable, sometimes perhaps when you're just going to the toilet and when you wiped afterwards. And that is thought to be the fertilised egg, and the embryo just implanting into the lining of the womb. If you are further on in your pregnancy, or any stage in your pregnancy actually, and you're experiencing any like fresh bright red bleeding that's quite abundant, then do contact your care provider without delay, especially if you are having abdominal pain as well. If you are having lots of bleeding and abdominal pain, then it can be a sign of a miscarriage if you are in early pregnancy. If you're bleeding a bit later on, then that can be a sign of an issue too, so it's best to get seen as soon as you possibly can. But spotting is very, very normal and very, very common in the early stages of pregnancy.